Some Australian boys are making an important contribution to the fight against cancer. They've become the first in the world to be given a locally produced vaccine that's already saving young girls' lives. Erin Bell reports.
Dominic will never have to worry about contracting cervical cancer, but today he's getting the same human papillomavirus vaccine used to prevent the disease. It's a world first, vaccinating 12 and 13-year-old boys with Gardasil.
Good morning, kids. How are you?
Good.
Excellent. Looking forward to getting a needle?
No.
They are looking forward to the benefits.
We know not only will vaccinating boys help protect girls who haven't been vaccinated, it'll give them protection against other types of cancers.
Older students aged 14 and 15 will be next as part of a catch-up program.
4 out of 5 people who are sexually active have got HPV, human papillomavirus. So if we can immunise children long before it's likely they become sexually active, then we can protect them much better.
Comparing their battle scars today, these teens were proud to be part of the flagship group.
I'm happy that I got it because it saves me spreading it and the girls getting it to me.
It hurt a tiny bit, but, you know, it's better than getting cancer, I guess.
Since 2007, more than 1 million girls have already been vaccinated with Gardasil. This campaign is hoping to vaccinate at least 280,000 boys at schools across the country this year.
Once we prevent this cancer, then maybe we have the chance of doing this in other cancers later on.
The boys' vaccine program will cost the country $21.1 million over 4 years. Erin Bell, 10 News.
Against the human papillomavirus, or HPV. The vaccination will not only protect boys but also reduce the spread of the virus to young women, reducing instances of cervical cancer.
The students were all ears for a rather unsavoury message from the Health Minister.
You're not going to like the sound of this, boys. You can get cancer of the penis, you can get cancer of the anus, you can get cancer of the throat or mouth, all from this virus.
But the HPV vaccine can prevent all that. Only given with parental consent, the vaccine is administered as 3 doses over a 6-month period.
They're vaccinating 12 to 13-year-old boys and girls. There's a catch-up program for 14 and 15-year-old boys.
Over 1 million girls between the ages of 12 to 16 have been vaccinated since the program began 5 years ago, wiping out over 70% of the virus among 18-year-olds.
In a world first, young boys are now joining the girls in receiving the HPV vaccine in an attempt to reduce the 700 instances of cervical cancer diagnosed each year in Australia.
It also protects boys from genital warts.
Just to protect us from the virus.
It just makes you think about cancer, and that's a really scary thing for me.
It's always good to be the first of something, I guess.
And even for people who may abstain from sex for lifestyle, religious or cultural reasons, HPV can still be a danger.
It is possible to spread it just through genital touching rather than intercourse.
For migrants entering the country in their late teens and early 20s, the vaccine is available through a visit to the GP, although it's only effective before the first sexual encounter.